All right, welcome to the Explainer. Today we are tackling two topics that you are absolutely guaranteed to see on your NCLEX: urinary tract infections and benign prostatic hyperplasia. We're going to focus on the priority actions and the safety alerts you just have to know.
So let's jump right in with a classic scenario. Imagine this. You've got an 82-year-old female patient and all of a sudden she's agitated, she's confused. Now, your mind might jump to things like a stroke or maybe a dementia flare-up, but for the NCLEX, what is the first thing that should pop into your head?
If a UTI was your first thought, then you are absolutely on the right track. This is one of the most common traps on the exam. And see, the key isn't just knowing the answer is a UTI, but it's understanding why it looks so different in older adults. That's exactly what test writers love to go after. Okay, so here is the single most important takeaway. In your younger patients, you're looking for those textbook UTI symptoms, right? The burning, the frequency, the urgency. But in the elderly, forget about it. The number one sign is often a sudden change in their mental status. We're talking confusion, agitation, maybe even new onset falls. Those classic signs, often completely missing. You have got to lock that away in your brain.
Now, how are you going to remember all the biggest risk factors for your exam? Well, we've got a great mnemonic for you. It's hard to pee. So H is for poor hygiene. A is for anatomy, thinking about that short female urethra. R is for retention, often from BPH. D is for devices like Foley catheters. T is for trauma from sexual activity. O is for obstruction like a kidney stone. And finally, P is for pregnancy. It's a super quick way to cover all your bases.
All right, so you suspect a UTI in your confused elderly patient. Let's get into the evidence. How do we actually confirm it? And what are the crucial medications you need to have down cold?
Okay, when you get that urinalysis back, you're looking for a power couple. Seriously. On the NCLEX, if you see positive leukocyte esteries, which just means white blood cells are in the urine, and you see positive nitrites, which is a direct sign of bacteria, boom, your confidence for a UTI should be through the roof. Cloudy urine and a more alkaline pH are also big clues that seal the deal. And here comes another classic test trap. You have to know the difference between the drug that provides the cure and the one that just provides comfort. Nitrofurantoin, or macrobide, is the antibiotic. It's the cure. It kills the bacteria. Phenazopyridine, or pyridium, on the other hand, is just an analgesic. It does nothing to the bacteria, it just numbs the bladder to relieve that awful burning pain. And don't forget the urine colors. The cure turns urine brown, while the comfort med turns it bright orange. You know, this conversation flows perfectly into our next big topic. We just said that urinary retention is a huge risk for UTIs, right? Well, one of the main culprits for that in older men is benign prostatic hyperplasia, or BPH, and that often leads to a major surgery that has some critical post-op priorities you absolutely have to know for the NCLEX. The gold standard surgery here is the transurethral resection of the prostate. We just call it a TURP. As you can kind of see here, the surgeon goes up through the urethra with a scope and literally carves out the extra prostate tissue from the inside. This opens up that channel so urine can finally flow freely again. Now, as soon as that patient gets back from surgery, they're going to have a three-way catheter for what we call continuous bladder irrigation, or CBI, and your number one absolute top nursing priority is managing this system. Why? Because that surgical site is raw and it's bleeding. The whole point of the CBI is to constantly flush the bladder so that blood clots don't form, which could cause a really painful and dangerous blockage. So how do you manage it? Well, you use your eyes. You're going to be constantly looking at the urine color in the drainage bag, using a scale just like this one. Your goal, your target, is a light pink color. We often call it pink lemonade, which would be about a grade 3 here. The darker and redder it gets, the faster you need to run that irrigation fluid. Okay, let's pause and think. Let's put you in the room. You walk in and you see the drainage bag is filled with bright red, clotty urine, like a grade 5 on that scale. Right here, right now, what is the very first thing that you, as the nurse, must do? Your priority action is to increase the flow rate of the irrigation. You have to get that fluid moving faster to flush those clots out before they create a blockage. This is always your first move before you do anything else. But what if increasing the rate doesn't work? The patient starts complaining of bladder spasms, intense lower belly pain, and you notice the output has slowed to a trickle even though the inflow is wide open. You need to immediately suspect the big bad complication, an obstruction. Okay, if you think there's a blockage, you have to act fast, and the order here is absolutely critical. First, assess. Get your eyes on the tubing and check for any kinks. If it all looks straight, your next step is to stop the inflow. Then you're going to try and manually irrigate the catheter with a big 50 ml syringe of sterile saline to try and break up that clot. If that doesn't work, this is now a medical emergency, and your next step is to notify the provider, STAT. Okay, let's pivot to one last topic that gets tested right alongside BPH, medications for erectile dysfunction. This brings us to probably one of the most critical safety alerts on the entire NCLEX exam. Listen up, because this is a 100% non-negotiable. You can never, ever give a drug like sildenafil to a patient who also takes nitrates, like nitroglycerin. Both of these drugs are powerful vasodilators. If you take them together, you can cause a sudden, catastrophic, and potentially fatal drop in blood pressure. This is truly a life or death teaching point. Okay, we have covered a ton of ground, so let's lock in this knowledge with a quick, rapid-fire review to see what stuck. You ready?
The answer is sudden confusion or agitation.
The right response is to teach them that this is a completely normal and expected side effect of the medicine. You're aiming for light pink or pink lemonade. Your number one priority is to teach them not to take these medications together because of the high risk of severe hypotension. And finally, the most important question of all. When you're looking at any NCLEX question, you should always be asking yourself this: what action will keep my patient from dying or having the worst possible complication? If you do that, you'll almost always find the right answer. Thanks for joining us.